organization? All right. So that's good because I know there's some people who have various activities. Good morning this morning. So welcome everyone. I am really thrilled to be able to share some information about our new initiative to have young global health catalyst clubs started all over the world. I think I know most of you who are on. For those who don't know me, my name is Dr. Lydia Asana, and I've been with the Global Health Catalyst from the beginning. And one of my favorite roles within our organization and our initiative is working with young people. So we've been doing this for quite a while now, and I'm really excited to share with you some information about a new way for young people to get involved, where they have the opportunity to take the initiative and carry out some of the projects that they have in mind in ways that are not as limiting as if everything had to come through GHC for every decision, for every project, and so on. So really, that's the idea of the Young Global Health Catalyst Clubs, that we can support, come alongside, enable young catalysts all over the world to take on initiatives and collaborate and move forward our common goals of increasing access to global health care, outreach, research, and education. So yes, that's what we'll be talking about this morning. There are enough of us on that we can introduce ourselves, and then as the others join, we will just be going on with sharing the information. So if you don't mind, you don't need to put your camera on if you don't want to, even though I'd love to see your faces. But in the order that I see, Christy, do you mind telling us where you're calling from and your affiliation?
Good morning. My name is Christy Benkuru. I'm currently in Maryland, and I actually received this invite from an organization that I previously interned with, the African Women's Cancer Awareness Association in Greenbelt, Maryland.
Okay, with Miss Iffy?
Yes.
All right, so glad to have you and to have them represented. Thanks for joining us.
Glad to be here. Thank you.
All right, next I see Yuri on my list. Uriel?
Hello, I'm joining from the University of Florida.
Thank you for joining this morning, Uriel. And then I have people working in the background. Peter?
Hey, my name is Peter. I'm from NGCU.
I'm sorry, I didn't hear where you're from.
NGCU, New Jersey City University.
Oh, all right, great. And how did you hear about the event?
I'm actually working with Bertrek for a while.
Okay, excellent. At Rutgers?
Yes, I was working with RUES and CINJ Cancer Institute last summer.
Okay.
And then I reached out to him regarding the program, the Global Health Cluster. So we're just trying to figure get more people from NGCU and other from Jersey City, Bayonne, wherever. So we're all over around.
Excellent. Glad to have you. Thank you. All right, Vrishni, I see you on my screen.
Good morning, everyone. Yes. My name is Vrishni, and I am joining from USF. I had the pleasure of taking a class with Dr. Asana last semester, and it was a pair from that class who told me about this opportunity.
Excellent. So good to hear your voice again. Thank you. Augustine.
Hello, I'm Augustine Bancolari. I'm joining from my home in Orlando, but I'm associated with the University of Florida, and I learned about this opportunity through my previous experience with the Young Catalyst Club.
Super. Glad to have you, Augustine. Ms. Vivian, I'll come to you in a minute. Armstrong? Good morning. Can you tell us where you're joining from?
Hi, everybody. My name is Armstrong Nicholas Bachi, and I heard about this opportunity from my cousin who happens to be in the US, and I'm calling in from the UK. I'm in London at the moment.
Excellent. Very good. So hopefully next time I'm there, you can give me all the tips and tricks to enjoy London. Okay, so this is all at every event I try to learn as well. So please correct me if I call your name incorrectly. And one of the goals of our Young Catalyst Clubs is actual cultural humility. So I will put out there from the beginning that I am humble enough, or I try to be, to learn, knowing that I don't know enough yet. So we will be learning as we go. Lejla? Correct me if my pronunciation is wrong. Are you able to let us know where you're calling from, Lejla? If not, Miss Vivian, who I hope that many of you will have the opportunity to interact with once you form your clubs, which is our hope, to help amplify some of the things that your clubs are doing, because she works with our media and communication. Miss Vivian, would you let everyone hear your lovely voice?
Good morning, everyone. It's so exciting to be here to just be a part of young people, because young people are the future for tomorrow. And as Dr. Asana said, I'm excited to host as many of you as possible just to talk about, your interaction, your interests, and how they align with the Global Health Catalyst and what we can do together for the future. So I'm excited to just be here and listen.
Excellent. Well, thank you for joining us. All right, Tim. Oh, well, actually, I mean, Labenyumo did say good morning, but some of us don't know where you're calling from. So would you let us know?
Yes, good morning. I am Labenyumo Patrick. I'm calling in from Philadelphia, Pennsylvania, but I'm actually associated with Rutgers, the State University of New Jersey. And I see Peter is part of my group, Armstrong, and I'm sure a couple more people will be joining from my group.
Excellent. Good morning. Glad to have you. I see Fatima is trying to connect, so we're glad that she will be with us as well. All right, well, so already we have several nations, several institutions, several groups represented already, and really that's what the Global Health Catalyst is all about. Our goal is to increase access to global health care, outreach, research, and education. And we realize that we cannot do that on our own. And so we highly value collaborations. And all that means is that everyone comes together, brings their strengths, brings their reach, because some of you are in places I have not yet come to and I would love to come to, brings your individual interests and passions and experiences. And then you also come with your needs, and you come with where you're lacking and where you're seeking support. And we truly believe that when we put all those together, it makes the work of global health that much more effective. So we're glad you're here. We recognize that everyone has a part to play. Everyone is able to contribute. And our goal is that at the end of the day, everyone is able to win, right? We always talk about win-win. So we hope that at the end of the day, everyone is able to win. And so my first question, if you don't mind just answering the first question on that poll, the question is, have you ever participated in a GHC event, either virtual or face-to-face? Just let us know so that we know if any of you, are you able to see that and participate in that? Yeah, so just let us know, question number one for now, if you've ever participated in a GHC event. And that can be either virtual or remote. And with that, I'm going to go ahead and get started just sharing with you what the Young Global Health Catalyst Club, what we envision it to be, and what we hope you can be a part of initiating where you are, and promoting so that we can have more young people involved. And at the end of this event, all those who participate, we will send a summary of the outline as well as a document that really outlines what we're hoping to do. But often, for those who I teach middle school and high school students in science courses every now and then, because I think we need to get them young. But I always tell my students, even the older ones, it's great to have information. I try to present information first so that we have the opportunity to make sure it's communicated correctly. And then you can go home and read about it and come with questions. And so the idea this morning is that we'll have those conversations. We'll present what the plan is, and then send you written information to look over. And then you can come back with questions, communicate with me one-on-one, and we get others involved as well. So overall, the first thing is that it's not new for the Global Health Catalyst to engage young people. It's something that we've done over the years, that we've valued over the years. And not only looking at young people as those who will take over from us when, I decide it's time for me to sip my soda or cola or preferably freshly squeezed juice by a beach somewhere and have you take over. But we believe that you have value to add to global health work right now. And in all the years that I've worked with young people, every single year, every single semester that I teach a course, every single event that we have, I learn something new. I learn a new perspective. I'm humbled by my limitations in certain areas, and I'm not afraid to ask for help. But also, I'm continually inspired because you come up with new perspectives. You question the status quo. You ask, well, why not? Why can't we just do this? And we need more of that in order to move global health forward. So the idea of this program is to give more opportunities for young people to do that from all over the world, where you can say, we have a group of people interested in making a difference. Global health is about service, it's about leadership, it's about innovation, with the ultimate goal of bringing people access to healthcare and the inequities that exist due to no fault of their own. And we have a part in bridging those. And so we want to emphasize service, because really, if you're interested in global health, it's because you're interested in the inequities in access to healthcare around the world and all aspects of it. And so we have to have a mindset of service everywhere we go. And sometimes that service is in your own backyard, and sometimes it's across the ocean, but service is key. And even though we're going in as those willing and able to serve, we do that with conviction. And so that requires an element of leadership. We need to have a plan, we need to be organized, we need to be confident, we need to be correct. And so it is important to make sure that the information we're sharing is credible. And then we want to be able to publish that and share that information so that those we can't reach directly, they are also getting information. And in order to do this and to make sure we're credible, we're growing, we're learning, mentorship is a big part of that. And so we value our global health network because we have those who have gone before us, those who are specialized in different fields, and those who are learning what is new and what is current to share those. And mentorship is sometimes, it's vertical, as in those who are further along ahead of us with more experience passing it down, but it's always bi-directional. And it's also lateral because we want opportunities for young people to collaborate with one another. And then, of course, it brings opportunities for professional networking as well and professional growth. So the very real skills of organizing, of communicating, of planning, of executing, of reporting, these are gained life skills, career skills that we hope will serve you well as you move forward. And so our approach really is that we value the current contributions that young people are making. We value your innovative ways of thinking, and we value the extended reach that you bring by reaching communities that we may not be able to reach, by having passions and focus areas that not all of us can do at the same time. Lejla, thank you for putting in the notes. I see you're joining us from North Macedonia. And for those who just joined more recently, Shahana, Albarka, Fatima, you can go ahead and put in the chats for us where you're joining us from. That would be great. All right, so the key elements of our Global Health Catalyst clubs is, and all through our engagement of young people, has been to engage, equip, and entrust. So engage is the first step, is what you're doing now, just being a part of what is happening. We want you involved, we want you hearing, being aware, using the resources that are out there. And then the equipping is really on-the-job training in a sense. You're best equipped by participating, by carrying out projects on your own, by starting a volunteer event, by publishing some work that you've done. Because as you do that and we connect you with mentors, or we're able to look back and come alongside you, you are gaining the skills and fine-tuning the skills to make that work even more effective and make you more effective in the things that you plan to do. And then we very much believe in entrusting you. Right? If you come up and say, we have an idea to do this or that, and I help you to tweak it, or I bring along a colleague to help you to tweak it, then we entrust that you're going to carry that out to fruition, come back and report that. And so that's what we mean when we say we want to engage, we want to equip, and we want to entrust. And then we have certain goals that we hope to achieve while you're carrying out these activities as well. Our hope is that if you form a club, and we're going to go through more detailing what the structure is and stuff like that, but just to give you some background, that you would commit to doing something for a whole year. Typically, we work on an academic calendar because a lot of us are affiliated with institutions, either as students or faculty, and so we want to fall in that cycle. So really, we would be starting up now, aiming to be done earlier on in the summer, and also being done in time for some of you to have the opportunity to share your experiences or your projects at upcoming summits. So in the process, we hope that you're able to identify and highlight leadership that you have expressed and exhibited, to communicate how you have served your local and global community, how you have learned. Scholarship is important to us as well, that we talked about sharing credible information, that you are finding out, researching, able to reference, able to cite your sources, and so on. And then cultural humility is one that is really important. And the idea of cultural humility I referred to at the beginning is just recognizing that we don't know it all. It's not enough to say, I recognize their different cultures, different perspectives, different historical vantage points, but we also want to confess that our understanding is limited if we have not experienced it ourselves. And yet we have a willingness to learn. We have a willingness to experience. We have a willingness to share of ours as well. And so that is critical to global health work, because in the term global, it means that we're going to be interacting with people that are different from us in perspective, in upbringing, in culture, in beliefs, in different ways. But we go with that openness that there's much I have to learn. I may not understand it all. I may not agree with it all, but I'm willing to learn. I'm willing to collaborate. I'm willing to respect, even when I disagree, for the ultimate purpose of increasing access to healthcare for those all around the world, be there in your backyard or across the ocean. I think we had another question, another poll that referenced. Gabby, do we have what was our second question? Let me see where that comes in before we start talking about the structure of potential. What minimum number of members would you recommend we require to start a new club? So our goal is to give you information now so that you can think about starting a club. And so as I talk about the structure, I'd like you to think about how many people do you think it takes to make a difference to start a club? knowing that you will need some structure, you will need some leadership, you will need people to actually carry out the things that you're hoping to do. So do you think there should be a minimum? And part of this is also thinking about the fact that some people who are starting clubs are in areas where they're limited in resources, they're limited in access to certain things, but they just want to get started and overcome some of those limitations. So do you think there should be a minimum? And if so, and this is a minimum to start a club. All right. And now these we will share, and at the end, give you a chance to look back and see, oh, perhaps now my perspective has changed now that I've learned some more things of what it takes. All right, so let's talk a little bit about what a structure of a club might look like. And for those who joined more recently, I did share that we will have a conversation. At some points, I'll give breaks for questions, but at the end, we will send the actual document that summarizes all of this to each of you so that you have a chance to read through, and then you can contact us with questions and we can set up meetings with individual groups or individuals to ask questions beyond this event. And so we would like that clubs that are formed, that idea of a minimum, we will consider what you put in the polls, but we have some thoughts of our own already, that there would be there would be certain categories of clubs so that we can have engagement from young people as young as high school. And for any high school groups that are formed, and if you know of high schoolers or you know of high school teachers, this is open to them. We're very much aware that we have to put some other considerations for minors. And so we are in tune with that, and there will be considerations for that. But we recognize that high schoolers can already get engaged. So we have our junior catalysts, which would be high schoolers. And these are typically students or student aged, right? We don't always say it's just students because depending on where you are in the world, there are different opportunities available to you. We hope that you're in school, but perhaps you're learning a trade or something like that. And so junior catalysts would typically be high school aged, between the ages of 13 and 17. And then we have engaged catalysts, those we've worked with consistently for years, are typically undergraduate level or individuals between the ages of 18 to 23. And then we'll have our equipped catalysts. We believe that you already have some skills and experience built up, and typically it's graduate level students or individuals ages 24 to 29 or so. And then our emerging catalysts, we believe you're actually out there starting up your careers or in residency, things like that. So typically young professionals, individuals ages 30 to 39 or so. This does not mean that others with more experience in life and career cannot be part of the Young Catalyst program. We actually need you to engage advisors and coordinators. So those who don't fall within these categories of age, experience level, we can invite you, and I encourage those thinking about clubs to invite them to still engage as mentors or coordinators or advisors for your clubs. Now, who can host a club, or where can these clubs be initiated? They could be part of academic centers, such as schools or training facilities. They can be part of community organizations and nonprofits, healthcare organizations and systems. I recently was put in touch with someone who is coordinating residents at their hospital, and they have a global health program. So you could even go to such a program and say, hey, could we form a club to be affiliated with the Global Health Catalyst so that we are part of that network, we're part of that platform, and extend our reach and participate in these win-win collaborations. Now, we'll talk a little bit about the structure, and then I will give some room for questions if there are any at that point before we proceed. So in terms of structuring your clubs, we expect that each club will have an advisor or advisors who can help make sure that you are adhering to the guidelines that we request, and that at the same time you're adhering to the guidelines of your specific institution, organization, community group, and so on, with respect to what it takes to be a club, to be a unit. And so those advisors will help to bridge that gap. You need some coordinators, somebody or two people who would directly be in touch with the GHC consistently. You're getting information from us and passing on to your clubs. You're getting information from your clubs and passing on to us. You're making sure that your club is included in opportunities that we have, that you're getting, you know, all the information and being part of that as well. And then you need leaders within your club. These clubs will be run essentially by the leaders who form the clubs, who are members of the club, but you need to elect or have a system of designating your leaders. And then, of course, your members who will help to carry it out. And for each club, we would like to give you that freedom, opportunity to create your mission and your purpose. And so while we know that we all have an overarching global health goal and purpose, each of us may have either a target population that's near and dear to us, or a particular ailment or disparity that is near and dear to us. And so each group is welcome, each club is welcome to identify, you know, their own purpose or mission. Our goal is to reach girls in our community who do not have access to HPV vaccinations, or our goal is to ensure that students on our campus are aware of the disparities in access to cancer screenings, or whatever it is. But you can work on narrowing down a particular mission or purpose, because that will also help you to be more effective. And then we have certain expectations of the clubs. And so this is where we'd like you to know that if you are already existing as a club, as a class, as a unit, it doesn't mean that you have to change what you're doing. We would like you to incorporate some of these expectations. So you don't really have to go out there and say, now I need to add 10 new things to our list of things to do, but rather to say, oh, well, we are already doing outreach in our community, and this meets this expectation by GHC. Oh, we are already planning an event with the International Students Organization of our school, and perhaps this meets that expectation of GHC. So we're not wanting to burden you with, 10, 15, 20 more goals to set, but to say, what are we already doing if you are already a unit of some sort that we could report, that we could emphasize, that we could see as meeting these expectations? And if you're forming a brand new club, well, then you can take these and say, hey guys, this is a list of things that by the end of the year, we need to get creative on how we meet these expectations. So one of them is that you need to do, so I'd love for you to take note of these, because then you can tell us if we missed something that you think is significant, that could be an expectation across the board. We would like teams to be coherent. And so one of the expectations is that you have some kind of team building activity or social activity or team building event, right? So some of you have been parts of groups that have done the obstacle course and the trust falls, or a movie night that follows with a discussion, or whatever it is, but find something that will bring you together as a unit. So you do need to have one team building or activity or social event. You need to have a local community service project or event. So even though we think global health, we believe global health is local health, and local health is global health. And so do something for your local community, with your local community, to serve your local community, whether that's your campus, your host organization, your neighborhood, whatever it is. And then, of course, serve your global community, something that is more global, outward looking. And this might be, you can be creative. You can say, we are serving those from different cultures that are in our neighborhood, our school. It could be, we'll do a virtual event so that we can have a global reach and participation. But I know that you will all come up with even more creative ideas than that. We anticipate that each club will do a purposeful cultural humility enhancing experience. So something that will allow each member of your club to learn something new about another culture, to have a better understanding, to grow in respect and appreciation for things that are different from the way you see things, the way you do things, the way you thought about another group of people or another culture or another geographic location. This one is really, really important to me because it so shapes the way that we choose to serve and lead. And the more we learn, really, the more humbled we are that we don't know. And there's good out there that we're losing out on, and there are limitations in our own cultures and geographic settings that we thought were so great until you find out there's even more out there. And then we would encourage a publication from each. And so this is part of that scholarship. And before you start thinking, oh goodness, I don't know that we can do a peer-reviewed publication and have that out in one semester or 1 year, you need to look at publication in a broad perspective. It would be great if it's a peer-reviewed journal, if it's a book chapter, but your school has newsletters, your community has local newspapers, you have different organizations that send out newsletters or community leaflets or whatever it is, where you have an opportunity to say something about global health in particular, something about your club, services that you offer, an event that's coming up, but making that public through some kind of publication. And for those who are just starting off, maybe it is your school paper or your local newsletter, but you should always, of course, aim for those higher peer-reviewed journals and things like that. And we want to come alongside and help you. And we actually have some projects that will be open to club members that I will talk about towards the end, that you could be a part of. Your club could come along and say, hey, we want to help, or be part of a book chapter for that book or that project. And then, of course, GHC, our core, care, outreach, research, and education. So we'd like you to pick one of those and carry out a project. You could go to perhaps a faculty member on your campus who is doing research that you can see as related to global health and find a way to participate in that research and then use that as a project. Or an outreach event, educational. You could decide to bring a speaker to a club event or a school-wide event and say, hey, we would like to propose a speaker for this conference that our school hosts, so that there is a global health voice, a global health expert that is meeting our goals for education. And then club representation at events. So at GHC events, we would like to see at least 2 members at 4 or more GHC events during the academic year. So that means that an event like this one, when you log in, you would put your name and then put your club in parentheses, and we would see that your club is represented. Where we have face-to-face events, recently we had one in Bangladesh. We've had events literally all over the world. So there are physical ones you can attend, but we will always have virtual events as well, so that it's doable. So hearing all those, our question number 3, Gabby, if you would, and I'm so thankful for our volunteers, young people who help host our events, including our virtual. So I think question number 3, do the club expectations seem achievable? And remember, we said we're looking to have each of these 1, 2, 3, 4, 5, 6, 7 that are listed, interpreted in some way and then carried out. And then you need to communicate to us, how does that meet this expectation? And tailor it to the goals, the missions, what's feasible for your club. So our question is, do these expectations seem achievable? And while we're getting those answers from the poll, I would also ask, does anyone have a suggestion or a question up to this point about structure, about expectations, about the goals or the background? If you have a question, I would invite you, we'll just take a couple of minutes to, you can mute your mic and ask a question or type it in the chat. You could also make an observation like, I am talking way too fast, or I did not spend enough time on this and that. Any questions or suggestions so far? So far, so good. And if you're not ready to share them on this platform, please do let us know afterwards.
For the club
Yes.
member requirement, I know some universities have, or some schools have like a specific amount of members that they need to for a club to join. Would that impact like the individual club's member decisions?
That's a really good question. So for a situation like that, if your goal is to start a club at your school, you need to first and foremost meet their requirements. So if we say you only need 5 members, for example, but your school requires that you need 10, then you certainly need to defer to the requirement for your school, because otherwise you cannot legitimately host a club on your campus. And so those are the kinds, or if we require 10 and your school requires 4, then we'll have a conversation. But usually the challenge is if they require more than we do what is needed to legitimately have a club on your campus. And where there's any potential conflict, then let's have a conversation, because we want to facilitate your ability to host a club on your campus. Does that answer your question?
Yes, thank you.
All right, super. Any other thoughts or questions with regards to this seeming doable? All right, let's talk a little bit about benefits of having a club. And that is a key part. One of the things I would mention is that as far as the GHC, Global Health Catalyst overall is concerned, I want to make sure I didn't miss a question. Can we make a GHC Young Oncology Health Club in Bangladesh with our school boys or girls, and also some college students where the junior doctors would help them? So if I understand correctly, is it that you're looking to start a junior club and you serve as the advisors, coordinators, and facilitators? Or are you looking to have a club that spans more than one category?
Yeah. Hi.
Hello.
Yeah, hello. Yeah, we want to make a different type of clubs where as you know, the Bangladesh, there is yet the SPV vaccination is not available. That Gavi has donated some of the vaccine where it is distributed in only the capital city.
Okay.
And where if we make a junior club or the different club like GHC Health Club, where the school boys and girls, where we can make a awareness program in schools and also college, and where then I am working in gynae oncology department, and where my junior doctors or junior colleagues, they are also the gynae oncologist and other oncologists, they can help, and they can monthly or the 15 days they can make the school the orientation program, that is what is the cancer cervix and where the vaccination is important and why they should take the vaccine and about the screening. And also we can include subsequently we can include the NGOs in that areas.
Super. So I see that as an opportunity for your students and junior doctors to form the club, and then their target and their mission would be to serve these schools in the area, particularly related to this vaccine campaigns. And so that's an excellent idea, because from there your mission comes out, from there your project already comes out, from there so much already comes out, but they already have a starting point. That would be excellent. That would absolutely be excellent. Yes.
And not only that, we can make awareness program about the cervical cancer screening.
Yes.
They can
Yeah, and so that's that of our core, the care, outreach, research, and education. You actually have outreach and education happening at the same time. So at the very least, and then they would have to conduct research and find appropriate ways to communicate that to the younger students, to understand. So that would be most welcome. Yes, absolutely.
Can I make another question?
How about we let let's have Labinyemo ask his, and then we'll come back to you if there aren't others, please.
Okay.
All right. Go ahead.
So in terms of meeting the requirements, assuming you have a couple of schools that are collaborating. So I can give you an example. Peter is working with me and he's at New Jersey City University and I'm at Rutgers.
Mhm.
We all both have to meet the requirements of what the school's requirement for a club is, or we could just have one because I'm helping lead the work. So if it just meets the requirement of Rutgers, is that good enough? Or we have to meet both the requirements of NJCU, which is New Jersey City University, and then Rutgers. And then because we have a couple of schools, like a lot of schools that are involved. So how do we deal with that in terms of meeting requirements of different schools?
That's a very good question. My initial suggestion, sometimes I go back and I sleep on it and then I'll send you an email to say, wait, let's revisit that. But my initial thought is that you may choose a primary institution to register your club at, or you may choose not to register it at any of the institutions and make it a community or an independent club. It must not be registered at an institution. So where you are having them come from different areas, you could make that a regional club and then have then we would have the conversation about, are there any requirements for your region? Then maybe it's your county, for example, where you just have to meet, basic as a citizen or resident of this county, we're not going to break any laws, and that's okay. So it must not be anchored at an institution. You could choose a primary institution, and then part of your club is making it very clear that you actually are collaborating with other institutions, which GHC is always about collaboration. Or you could say this is an independent club hosted in this geographic area. And then we just say, don't break the laws of that geographic area, please. And so we can have conversations about that for your specific situation. Does that help?
Yes, thank you.
All right, super. Do we have other questions, or can I go back to Professor Shahana?
Yeah. Is it possible to make a time for you to make a meeting for making that club? And also we are working on that, why that research in oncology is less in our country. Yeah, and what the barrier for the minimum research in oncology. For that reason, we can, if it is possible, to make a time for making a meeting, so we can include the doctors where we can, and you can explain that everything what we
Yes.
have explained today. Then all the doctors and our junior volunteers from the school, some of the junior volunteers from school, and also the college students, they will be in the meeting. Is it possible for you?
Yes, absolutely. So we're actually going to talk about that towards the end, that what is the next steps. And so that is
Okay.
those who are interested in forming a club, that is one of the steps, is indicating that interest. And then we set up a meeting with those that may need to hear and discuss and help to formulate what's best for your club. Yes, I would be happy to do that. And then hopefully some day I can come to Bangladesh and actually meet you all. That would be lovely.
Sure. Yeah.
All right. Yes, I would be happy to set up a virtual meeting. Yes. All right, let's do it. Was there another question? I want to move on to benefits and give an opportunity for some of you who are on here to just share briefly benefits that you have observed as being part of Global Health Catalyst as young people. But I'll share some of the ones we have in the document that we will share with all of you. The main thing I'd like to share is that we are all about win-win collaborations. So when you hear Global Health Catalyst, you should immediately think collaboration, and then you should think win-win collaborations. So when we talk about benefits, we're hoping that you will see benefits to your host institution, your host organization, your host region or community, because this is an opportunity for you to highlight the resources that are in your community, your institution, and some of those resources are you, the club members. It's also an opportunity for you to share the needs that might be there. And when I say the needs, I don't mean necessarily a laundry list of everything that's going wrong in healthcare, because we all have those. But I would challenge you to identify needs in perhaps we would really benefit from an expert in this area to come and educate our club. But our club is excellent at this, and we would love the opportunity to share that with another club that's looking for what we have to share. So I would challenge that every time you share a need, you also think about what you have to offer, because it's really important to us that we challenge these perceptions that there's a group of people that have all these problems and a group of people that have all these solutions. So for anyone who's taking any of my global health classes, or even I think I did a nonprofit class, Vrishni, maybe that's the one you're in, but it's always about there are perceptions in the world about those who have needs and those who have solutions, those who have wants and those who have resources. And I am a big proponent of saying, every single one of us has both. And we want to be a model of showing that to the world. I may not have a pair of shoes, but I can make excellent baskets. So help me get a pair of shoes and I will give you a beautiful and practical basket to use in your home. There's always an opportunity to give and take. So you have the opportunity to represent this for your host institution, organization, community. Share with us what you're doing great, the achievements that your organization is doing, the part that you are playing as a club to move the mission of your organization forward. And then share with us perhaps some challenges or needs that you have for our network to be aware of, so that we can see how those gaps could potentially be met through collaborations. So there are benefits to the host institution, organization, community, and so on. There are benefits to Global Health Catalyst. And so we are very upfront about the fact that we want wins for us, right? It's not like one of those marketing schemes where this is all about you. If you don't have skin in the game or something you'd like out of a partnership or collaboration, then it's really not worth it. And if somebody is marketing something to you as if it's all about you, you should question what it is they want out of it, right? And so for Global Health Catalyst, we see it as a win for us because you're helping us live out our mission of catalyzing collaborations for global healthcare, for global health and development. That is why we exist, to catalyze collaborations. So as clubs are formed in Bangladesh or in the UK, in New Jersey or in Florida or anywhere else, these are opportunities for new collaborations to form so that the work of global health moves forward. And when we talk about global health, yes, we're concerned about healthcare, traditional healthcare related things or health related topics, but we know that this is intertwined with development as a whole. And so that's why we always talk about catalyzing collaborations for global health and development. And so it's a win for us. When clubs are formed, you help us live out our mission. It's a win for your hosts because you get to represent them, you get to highlight the work they're doing, and hopefully bring some collaborative resources. And ultimately, our hope is that it's a win for each of the members within the club, that your leaders, are growing in their leadership skills, that all of you are serving. And so those are experiences through which you're humbled, but you're also motivated and empowered, and that each of you are gaining connections and growing your network, building friendships, because the next thing is you may need a recommendation. You may need ideas or resources to study for your MCAT, or you'd just like to go on vacation and would like to know somebody on the other side of the world who can give you real tips. But these are all life experiences that make each of us better. And so hopefully each one of you would see it as an individual win for your professional as well as your personal growth. And so those are overall the types of benefits. And some of those that we've had past participants share is that it gives access to Global Health Catalyst events and summits. Most of the things that we do are free to attend. Some of them may have a cost, especially our summits are probably going to transition in some way. But members of clubs would have access to summits at low or reduced costs. We're committed to that. Access to our global network of scholars and practitioners. And so we want to facilitate. If you were to have a conference at your school and you needed a speaker, we could try to support and say, let's see who in our network might be a good one for that particular one. Access to opportunities and resources. So before I forget, one of the things I would share, Vivian and I work on regularly is our GHC newsletter. And so one of the sections of that newsletter, one just went out yesterday, I think, is opportunities and resources. So as part of your club, your coordinator would ensure that any resources and opportunities that we're made aware of, we're communicating that to your clubs. And so right now, the newsletter that went out, there was one for sending in, I think, abstracts to speak at a conference next year. There's a research grant for research in Kenya, I think it was. There's one that's related to AODIC, that there are grants as well for early career. So these things people bring to us because they already know we have this network, and our goal is to send them out, and you would always get those, that type of information. Advising and support. So this, I try to make myself as available as I can, but we do have a team. And so once you come to me with something very specific, I will quickly tell you that is not my wheelhouse, but let's see who can help with that. Enhanced visibility for you, for your work, for your institution. So we will be spotlighting. Ms. Vivian will be doing interviews with different clubs. We will be celebrating your wins and putting those on our platforms. There'll be a special abstract submission category for global health clubs around the world. So if you're submitting an abstract, instead of going in with everyone else submitting an abstract, we'll have a category because we're committed to having a certain number of presentations from GHC clubs. And so that's something that might be of interest to you as well. Leadership development. We often have training opportunities as well. Currently, we have an implementing science course that just started this week on Wednesday, I think. And the content is based on one of our recent publications, Win-Win Approach to Global Health, something. But we'll share that flyer actually at the end. But these are opportunities that club members who are interested in the topics that are there, speakers from all over the world. I think one of our greatest strengths is the strength of our network and the people who are there. And so we are often engaging, inviting, and so thrilled that many of them accept to give up their time to be able to share from their experience. And so these kinds of courses are available to our club members. And then let's see, leadership development, of course, global interactions and increased cultural humility. And here I'll mention that one of our next meetings like this that we'll have will be focused on cultural humility, and we'll be calling on different clubs to put together a presentation that represents some aspect of their prevailing culture. Because I, for one, would love to learn, and I love to share about my home culture. And that makes us all the more open to new ways of doing things or new ways of identifying real needs and potential solutions. And then, of course, peer engagement. All of you who are on here, this is a potential new pool of networking opportunities for you. And then eligibility for funding projects that we may have. And at the very end, I will share 2 incentives that we currently have for newly registered clubs and for any clubs that register by the end of the year. So those are some of the benefits that we have identified, that some young catalysts in the past have identified that they appreciate about their participation. And so I would love for maybe 3 of you in about 3 minutes or less, maybe more, who have been to a GHC event to share with us what your experience with the GHC was, what you saw as a benefit, and what recommendation you might have for someone considering whether or not it's worth their time and energy to engage or to form a club or to be part of a club. So I know Uriel has been, Augustine has been, Julia, I'm not sure if she's on yet, but she was going to join from another event around this time. So I don't know if I'm seeing everyone who's on yet. Which one of you would like to start? I know Jabairu also has been part of our summit, one of the summits we had at Dana-Farber a few years ago, and was part of the Bangladesh summit. So I shall do impromptu. Whoever you would like to start. Labenyimo also has been. I know you were recently at UPenn, so I'm going to put you on the spot to start. Tell us what GHC interaction you've had, what you saw as a benefit of participating, and what you would say to someone wondering if it's worth their while to get involved.
Yeah, thank you. So I was fortunate to be part of the GHC Summit at the University of Pennsylvania. One of the benefits for me was I was able to be part of the panel that did the Global Health and Religion Forum, and I was able to present as part of the panel, which was huge for me. I also participated in the Q&A sessions. Not only that, interestingly, I met a lot of people from different parts of the world. I built relationships with folks from Ghana, Nigeria, and a lot of people really doing amazing work in different parts of the country, but also the fact that just going there and seeing people sharing different areas of expertise, but with a common goal of defeating cancer, and even religious folks coming together to say what is their role in trying to help healthcare professionals to reach to communities that are underserved and are marginalized. So it was really a very eye-opening experience for me. And the fact that I was able to participate and make good connections. I still speak to some of the individuals that I met at the GHC at UPenn, and we still talk about what the kinds of work we do right now, and possible ways in which maybe if this becomes something that we need to collaborate to do it, to make it even bigger or make a bigger impact, we could think about ways in which you could do that. So basically, I would say not only participating in the GHC as panelists, but also making some long-term friendships that I still keep in touch right now. So it was really, really a very important event for me, and I still remember. I watched the videos too to see how memorable it was. So yeah, it was great.
Great, thank you. And you bring up a good point. So, well, you bring up many good points, but you've reminded me, one of the resources we have available to you is our YouTube channel. And it has lectures and it has talks at conferences from really, really, I mean, people I have so much respect for who choose to come to our events and to give of their time because they're committed to this. You'll go to conferences where people are paying good money to get really great speakers, and we always have amazing speakers with amazing accomplishments who choose to do it as a service. And so that is one of the resources there. And we do encourage that these relationships that you're building will continue to grow. And that you'll continue to collaborate, which also brings up a question that Ms. Vivian put in the chat, that how can clubs collaborate with one another? And so in some of the introductions that we're doing or asking you to put in the chat where you're joining from, maybe any specialities, those are resources already there for you to say, oh, somebody's calling in from London. Well, I know that the London Global Cancer Week is coming up. Maybe I'll be going to London and maybe I can meet with someone who's there, or you're joining virtually, but take every opportunity. I take every opportunity when I attend a conference, even if it's virtual, to pay attention to what's happening in the chat. And sometimes I make connections through that and follow up with people individually. So clubs can be purposeful once we publish the list of clubs and maybe their mission, their purpose, their location, that you're able to see potential collaborators. If clubs share the projects that they have started or that they're continuing with, we encourage you to say, oh, who has a complementary project? Maybe we can work together to then increase our chances of being selected for presentation at a GHC summit. And so maybe you want to then purposefully pursue a collaboration with a complementary project in order to increase your score for collaborations, right? When we are in. So I'm going to do a little, so that's one of the ways that clubs can collaborate with one another. And certainly we will give opportunities for mutual interactions as well with our events that we'll have virtually 5 or 6 a year. And those are spaces where we will also be purposeful in identifying some clubs to play a particular role in some of these virtual meetings, so that it gives that opportunity to get you working with one another as well. All right, someone else who's been, maybe Uriel? So tell us, how have you been involved with GHC or an event you've gone to, and what did you benefit?
Sure. So I've been to several different Global Health Catalyst summits. I've been able to volunteer both in organizing and helping to set up, but also in being able to present and on particular topics. And the main benefit that I've gained from these is that the ability for first, not only a more global perspective on events that I personally may not have known before, but also a greater appreciation for the work that people are currently doing in attempting to not only educate, but to provide access to care in different parts of the world. We had these, you mentioned that there are so many different amazing speakers, and I've been able to sit in these sessions and really gain an appreciation. And that's one of the best things I've experienced.
All right, thank you. What about you, Augustine?
Hello, yes. Oh, my camera is not working. Yes, I have been fortunate enough to attend the Global Health Catalyst in 2019, 2022, and 2023, and all of them have been some of the most worthwhile experiences of my life. I have been so inspired by seeing all the work that's being done around the globe to address global health. And more than anything, the fact that we are all catalysts, no matter your status. We're working with, as an incoming freshman in college, I don't have much on my resume, but I'm so inspired to see these doctors and highly experienced professionals come alongside me and all have like a passion for the same thing. And really, no matter, even though that a lot of the younger participants may not have these large resumes that the more experienced ones have, they still support us. And it's very inspiring, especially as someone going into the academic field of college and such, being so inspired and ready to take on the challenge. It's amazing to go and see all of that.
Great, thank you. And so both you and Uriel actually brought up something that's worth noting. Uriel mentioned volunteering over the years, and Augustine, you've worked with us as well. And then the perception of inexperience. But by being involved, you are gaining legitimate experience that goes on your resume for those college applications, for those grad school applications, to say, I went, I served, I presented, and these are legitimate things that can really boost your personal and career growth goals and open up new opportunities for you. So I hope that you would all take advantage of those as well. Yes, anyone, I know, Jabairul, are you able to share? You know, you were with us at Harvard a few years ago, and you were at the most recent event in Dhaka.
Thank you. Really, it's a great experience for me. The first time in 2019 in Boston, I was attending the conference. It was my first international conference in which attend the outside of my country in Bangladesh. Really, it was very good experience and impactful presentation all over the three days. And after that, in the same year, in 2019, maybe October, first week or second week, the another GHC program held in the Germany University Medical Center Mannheim. Personally, I also attended this conference. At that time, I was intern at University Medical Center Mannheim at the faculty of Heidelberg University. At the time, also attend this oncologic workshop, and the last time in this year, also attend the Bangladesh chapter. It's a really great experience for me and a great journey with the Global Health Catalyst Summit. Thank you very much for inviting and also give me this opportunity, as well as I also try to join to GHC Summit, and they're all over the conference or workshop. And thank you.
Thank you. And thank you so much for being willing to take opportunities to go. I mean, you've mentioned at least 3 different countries where you've attended our events. And so where you have the opportunity, I would encourage all of you to go. Where you're not able to go, we really make that effort to provide virtual opportunities to join. And that gives you access to the information, the resources, the people, and sometimes can inspire you to find ways to either invite, have something local, or go to a face-to-face one as well. Is there someone else who is currently on, who's been to one of our events that wanted to share? I'd like to give you the opportunity. And if not, I'm thrilled that so many of you have not yet participated, but chose to join in our conversations this morning. I know Julia is trying to get on to share in just a minute. I believe we have another poll. Gabby, was there one that would be appropriate at this point as well, before we go on? We did the club expectations one already, number 4 perhaps? All right, so let's start talking about starting a club. If there are funds available, what do you recommend your club would spend any startup funds on? Do you think that if you had startup funds, it should be go to get t-shirts for your members, banners for your events, items for service project, or something else? And I will tell you that each of these options have value, which is why they're on there. And we're just curious what you think. If you get some startup support, excuse me, what do you think you would recommend your club spend the startup funds on? And I will explain to you a little bit. Whenever we have the opportunity, I will be one of your biggest cheerleaders when it comes to facilitating resources and benefits with GHC and for our clubs, to say, hey, do we have, even if it's a little bit, our clubs can do something with even a little bit, or to have you at the summit presenting. This is one of the things that I focus on, is let's give our young people a platform. Let's see if we can give them resources. And so anytime that there are funds available through GHC, there will be conditions, of course, because we want to be good stewards and responsible. And so before you're given clubs, you would have to be approved anyway. You would have some guidelines, as in, this is startup for your club, so do whatever you like for the benefit of your club, or this is specifically for this type of thing, so let us know what you plan to do with it. And a lot of times we would give you the terms or the way in which those funds would be transferred, because we have collaborators and partners in so many different parts of the world. It's probably not going to be a check or a bank transfer, but we would always work out, are we getting receipts? Are we, having you as a vendor that can then bill us? But we work through those details. But I can tell you right now, it's probably not going to be cash or check. And that's part of the reality and part of the learning and growing, that you learn to request or apply for funding, itemize how it will be spent, keep your receipts, and then submit a report. So all of that is purposefully part of your training, but it's also good stewardship on our part and transparency. And so we will look at all those polls towards the end. But at this point, I wanted to share opportunities that we will have. Let's see, well, before the opportunities and incentives to start a club, we have several platforms through which you can be engaged, through which you can get information, share information with us that we could consider putting on our different platforms. So if you are not already or did not know, we do have our newsletter that goes out regularly to our mailing list of several thousands around the world. So every now and then we'll send out something very specific, but about every month we send out something general, often with something the GHC has recently done, something we're going to do soon, and resources, opportunities, or spotlighting collaborators. And once we have clubs, we'll be spotlighting clubs as well. So if you are not yet getting our newsletters, I would encourage you to sign up for that, and you can do that through our website, globalhealthcatalyst.org. We also have a LinkedIn group, and this is where we would encourage you to share what you've done if you have an event coming up, so that others in the group can join remotely, support you in some way. We have our LinkedIn page that sends out official information, resources, events that are coming up. We do have an Instagram at GHC Youth that we recently started, and would love to have club members use that space also to share what they're doing, how it went, and just to move global health forward, make other young people aware of it and the work you're doing and the benefits that are there. And then, as I mentioned earlier, there is the YouTube channel, and all of these we can make available to you in a follow-up email. But that has a whole lot of resources. Sometimes you're looking for resources even for a class project. And that could be one that you could access on specific topics, from, surgery to radiotherapy to immunotherapy to vaccinations. Miss Vivian just recently had an article about breast cancer in men and the need to have more conversations about that. And so we get excited about topics like that, because these are things that we all know, and we all tell people it can happen to men too, but we're not hearing enough of it. And so, as part of Breast Cancer Awareness Month, she has that article. It's on LinkedIn. If you're connected to me or to the GHC groups, you can see those there. But these are things that raise awareness and make us think, oh, this is something we should be talking a little bit more about. And so we would love for you to engage with us in those different ways. We would love for you to help support getting these, our conversations and information we share, have that multiplied using hashtags that are recognizable as well. And so we are looking to encourage you to start clubs. And so for now, what we have been able to secure at this time is that for the first 5 clubs that complete the registration process by December 1st, I believe, I'm going to send you all a document. I'm going by conversations right now. We will give you, I think it's $200 startup for your club. And so not necessarily, it could be used towards a project, but we want to build that club morale. We want to help you do something just to get your club started. And so we're asking you to consider registering by December 1st, I believe it is. And the first 5 clubs to do that will have just that little startup incentive. But for all clubs that are registered before the end of the year, we will also have the opportunity for you to apply for a little bit more funding, a little micro grant, specifically for a service project. And so if there's something that you would like to carry out on your campus or in your community, for which you may need to purchase a few things, you may need to make some calls, you may need to just make sure you have water. We want all of you to be safe and healthy while you're out there. If you're out in the sun, please have water for your team members, some healthy snacks, as well as the resources that are needed there. And I think there'll be a couple of $500 opportunities and a couple of $1,000 opportunities that you can, as a club, apply for. And like I said, for those, you would be for a specific project. If you have in mind something you'd like to do, then start thinking about how you could apply for that micro grant and how that funding could help, or what specifically you would do for it in order to serve your target community. So those are the 2 that we currently have, just a startup incentive to get your club going, as well as these micro grants to do a service project. And our goal is that these projects would be completed before the next summit, so that it gives you an opportunity to present that project at the summit, what you did, who was involved, how you learned and grew in the process, but also the impact that it had. And so if you can be at a summit physically, that would be great. But if you're not there, we can also find ways for you to present virtually. But we do want to prioritize the opportunity for clubs to share the impact that they're having. And so the next steps after this would be to, if you're interested in starting a club, you would send me an email. We would send you a basic form. You can already start thinking about, hey, do we need an advisor? You know, start talking to potential club members. Who could we approach to be our club advisor? Who could be our coordinator, or among the members, who could be our coordinator? How will we determine our officers? What target population do we want to serve? Is there a project? Is there something that's already going on in our community or our campus that we could add on to? Because that's a great way to increase your impact. If there's already something going on and you say, well, we can do this piece of it, and then we're part of a bigger project, and report that. So these are some things for you to think about. Are there any questions or comments or suggestions or something that I missed as we move towards the end of our time together today? So appreciate your sticking with us and hearing everything through, thinking about it, sharing. Questions, comments, anybody need clarification on something? After the event, we will send out a document that summarizes all the things that we talked about. And then, of course, you can reach me by email with any specific questions. I'll put my email in the chat now, but you can, or you could, you know, contact us through the GHC website, and those emails, if you put Young Global Health Catalysts somewhere in the subject, it'll find its way to me as well. All right, so we do have one more poll question, the very last one. Gabby, could we have that last one up? All right, I'm putting my email in the chat for those who don't have it yet. Global Health Catalysts with an S at the end. I always try to remind there's an S at the end of that. If you have some questions or follow-up comments after this. Gabby, do we have one more poll question? Number 5, I think there was. Number 5, are you considering forming a Young Global Health Catalyst Club? Yes, no, not sure. And not sure is a legitimate answer, but that would be a great opportunity for you to ask a clarifying question now, right? If you're not sure, if it's because you have more questions, I would invite you to contact me to ask any questions you may have, any reservations you may have. Maybe it seems like a daunting task, but maybe once you start talking to 1 or 2 friends, then you start realizing it is doable. And we so value just starting a thing is the hardest part. But once it's started, and if you're focused on the service that you will bring, the information, the increase to access that your efforts can make, it can really fuel you to move forward. All right. I think I've covered most of. Do you thumbs up or down? Do you believe you have enough information at least to consider forming a club? Or if there's a topic that you think we missed out in sharing about, then just put the topic in the chat. But do you have a sense that, oh, I have some basic information that can get me started along this path? I see maybe 3 thumbs up. That's a start. Thank you, Faith. Okay. What do you think would be the biggest challenge? Thank you, Albert. Vrishni, I see yours as well. Jabairul. What do you think would be the greatest challenge to starting a club? Could you put a topic in the chat so that we can also think about addressing those in resources that we share? What do you think is the greatest challenge, the greatest difficulty that you envision at this point in starting a club, a Global Health Catalyst Club? And while you type that, I did notice earlier there was another question. I don't remember who asked, but someone asked if you can start a club in more than one school. Let me see. I don't remember.
Yeah, I asked that.
Okay, great. So clarifying question, do you mean you starting a club in more than one institution? I just want to make sure I understand your question correctly. Yeah?
Yeah.
Okay.
Yeah.
So certainly that is very feasible. The question would be, what is your role in starting? You could seek to be an advisor to two different clubs and then have them set up their leadership, set up their coordination. If you can handle it in terms of having the capacity to do that, that's great. And maybe once they get started, you identify colleagues in each school so that they can be a support to you as well. But yes, absolutely. Absolutely. They could be independent schools that you're affiliated to both. And the benefit of that is that you have a natural pipeline for collaboration because you are already something that ties the two. And so they could come up with complementary projects, and then you naturally have the opportunity to set up collaborations. And every time I say collaboration, I smile a little bit brighter because that's one of our goals. And so I see that as an excellent way to set up collaborations between more than one institution already. Yes. And through that, you could also build new lines of professional relationships with faculty and staff at both institutions. All right. You may already know people there, but once you're working on a common project, it does something with bringing you together. Now you have a focus like, hey, we were friends, we would hang out and drink tea together, but now we have a common purpose, and it sort of fuels those professional relationships. So that would be a great idea. If you're able to do that, then certainly that's acceptable. Yes. All right.
Yeah, thank you very much.
Absolutely, Albert. Thank you for asking. All right. Any other questions or anyone else willing to share their experience or recommendations? I see Julia has joined us. So Julia, could you tell us how you've been engaged with GHC? What were the benefits to you? And why you think it's worth someone taking the time to get involved?
Yeah, of course, I'd love to share. I hope y'all can't hear the background music that's going on right now. There seems to be a festival on campus. So let me know if I need to speak up a bit to overshadow the noise.
We can hear you.
It's all good?
Yes.
Okay, great. Yeah, I guess first and foremost, being a part of the Global Health Catalyst, you really feel this powerful sense of community, which is super exhilarating and super exciting and really makes you more passionate about global health, just making those connections with people involved. From my experience, I was able to make quite a few connections. And it's really, I would say it's like serendipity, where it's just even things that you never thought would happen end up happening. So for the last Global Health Catalyst Summit, I met one of the, I guess, frequent members of the summit. His name is George Intim, and I told him that I was from Trinidad and Tobago, and he was like, oh, I know quite a few ministers from Trinidad and Tobago, and I know your prime minister. And he was particularly friendly with the Minister of Planning and Development from Trinidad. And he asked me if I wanted to speak to her. And I was like, of course, I definitely would love to speak to her. And so he called her, and I was able to talk to her about a hospital in Trinidad that's being underutilized. And she herself had cancer. So oncology is a a particular field that she is interested in and certainly wants to contribute more to in Trinidad. So it's great to talk to her and connect with her. And I'm hoping that we can possibly communicate further and get like an actual project out of it. And other than just making those connections, I also had the opportunity to present some of the research I've been working on at Moffitt Cancer Center. So it's related to the Ghana breast health study. We were looking at the gut microbiome of subjects in the study and seeing if there's an association between their breast tumor microenvironment. So there's a lot of research now about the microenvironments of tumors in general and how that complex ecosystem really works to determine outcomes for cancer. So it's a really great opportunity to present some of the research I've been doing and possibly inspire some other students in the audience to conduct similar research, or even maybe some of the already established researchers to consider environmental factors in their research. So having a platform to discuss what I'm passionate about was really fulfilling, and then also being able to make connections that can help with projects.
Excellent. Thank you so much. And so just to think, like Julia, that was her first time to attend, and she already made connections with people doing research she was involved in, people from her home country, and now we're having conversations about how can we invite a representative from Trinidad and Tobago to a future summit, and that will extend our reach, extend our network, extend our impact, and really it's a win all around. And so I would encourage all of you, don't hesitate to make recommendations for the communities, institutions you represent, for the topics that you're most passionate about, because if I'm able, I'm going to find ways to help bring that, to highlight that in some way, and we can help one another with that. Just elevating issues that are of importance to us, promoting events, encouraging, celebrating one another along the way, sharing resources. That's the best way that we can all move forward. And so at this point, we are at 11:30. I really appreciate all of you. Well, 11:30 where I am, and some of you it's much later. So thank you for taking the time to join. I will be sending out an email with this document that summarizes what you can be thinking about in setting up your clubs. It will also have those incentives we talk about. Would be great to have some of you start the registration process. And then start thinking about a project that a microgrant could support you carry out that you could then potentially present at the next summit. We would like to share with you, I think there are 2 events that are coming up soon that you could be a part of, or members of your club. And if they participate at these upcoming summits, we're going to also we're thinking through perhaps a point system so that we have ways to recognize clubs and, stir you on a little bit more, that each time you attend, like this one would count. You've participated, in a GHC event. We have London Global Cancer Week is coming up November. It's a whole week in November, the 2nd or 3rd week in November, but the GHC event, I don't know if we have a flyer for that others could see. But if you find me on LinkedIn, I will always be sharing these, the GHC group, the GHC page on LinkedIn, and the Instagram. But London Global Cancer Week is an amazing opportunity for you to hear from organizations all over the world that focus in different aspects of cancer. Some of these organizations you've heard about, like World Health Organization and UICC. Some of them maybe you've not heard about yet, but then you'll be amazed that they are doing, really great things. So this event is the whole week. Some of the sessions will take place in London, and you can go physically and attend if you're in that area. Some of them will be virtual. So our GHC event, it's one of we just thought this is an opportunity to increase access as well. So our session will be virtual, and you can sign up on the GHC website to attend the session and hear from our speakers. and that's one way that you can gain information, build your network, participate in yet another amazing GHC event. And then we also have the science implementation course that's going on right now. Classes are about an hour and a half Wednesdays and Sundays with speakers from all over the world in different aspects. I am, if I can get my act together, we'll be doing a session on engaging youth. The book that we're using as the basis for this course we actually had some of our young catalysts as co-publishers in those chapters. One of the chapters that I worked on was related to engaging youth, and one was related to engaging the African diaspora. So, but there were all different aspects of global health, from scientific and, practical to social and economic types of topics. So I would encourage you to make the most of those resources. Reach out to me with any questions you may have. Thank you for those who've shared your emails and your willingness to extend your network with those who are on the call now. I look forward to getting your emails and questions and your indications that you would like to start a club, and just come alongside you to make that happen. If no last minute questions, I'll say thanks again for joining. I look forward to your ongoing engagement. Have a wonderful rest of your day. Bye,
Thank you,
everyone.
Dr.
Thank you.
Asana.
Thank you.
Thank you. Bye-bye.
Bye-bye. Thank you.
Thank you.
Thank you all.
Thank you, Doctor.
Thank you very much.